You'll receive your bag containing all the equipment you will need for your CPAP setup. Unzipping the bag, you'll find information on how to set up in this step-by-step easy card. At the back of the bag is a zipped compartment where you will find tubing. Middle compartment contains a CPAP machine and, in most cases, a humidification chamber. In the very front compartment are the power leads. The power lead comes in two parts. Connect the power lead to the power pack, and this end will go into the machine. Plug one end into the main supply, and this end plugs into the back of the unit, like so. Air is drawn in through the side of the machine via a filter which can be taken out, washed, dried, and then replaced back into the machine. This should be done every 2 to 3 months. Also at the side of the machine is an SD flap where a card is in situ. If you need to return the card, there is an envelope in the bag to have the card returned to the respiratory medicine team for downloading. At the back of the machine is the air exit porthole where tubing will be connected to connect the machine to the mask. The tubing should be new and opened. Once opening the tubing, there is a small connector that fits to the back of the unit, like so. And then one end of the tubing goes on to the elbow. The other end will connect to the mask. Once the power is connected to the machine will go through a quick diagnostic before coming to the home screen, where you have two options: My Option and Sleep Report. If the particular area is highlighted blue, it means that's the option you have access to. To gain access to this area, press the button and the display will show you the different parts of that menu that you have access to. All of these should be set so that you won't need to touch them. If, however, you're having issues and we need to talk you through changing them, My Options is what you will enter. The My Sleep Report is the screen you will see when you wake up in the morning. It tells you how many hours you've used the machine for and whether your mask fit was good. If you have a green smiley face, the mask fit was excellent and good. If you have a red unhappy face, you need to clean your mask and readjust it, ready for the following night's use. To exit any of the menus, press the home button at the bottom and that will take you back to your home screen. When you're ready to use the equipment, the on-off button is at the top. Press and the display will show you how much pressure the machine is giving at that particular time. The most important option on the menu that you will need is the mask fit option. To get to this, make sure the My Options is highlighted in blue and press the dial. Down the second from bottom is the mask fit option. If you twist the dial so that that option is highlighted blue and press, the machine will automatically give 10 centimetres of water in pressure. This may not be your prescribed pressure or required pressure, but it is a good average pressure to check that there are no leaks from the mask. If you have a green smiley face, it means the mask fit is good. If you have a red unhappy face, it means that there is too much leak and the mask should be readjusted. If the mask is readjusted and the face becomes green again, the mask fit is good. To stop the mask fit option, press the dial again and the machine goes off. To return to the main menu, press the home button. If humidification is required, you will be sent a chamber that fits into the side of the machine. By taking out the cover, you can then place the chamber inside the machine. Humidification provides moisture to the air as it is blown into the mask. It does that by picking droplets of water from the chamber, heating it, and then the moisture from that heated water transfers down the tubing to the mask. To fill the chamber, unclip and fill the chamber with cooled, boiled water from a kettle to the maximum line. Close the chamber and insert it into the side of the machine. The machine will now automatically detect that there is humidification added, and when you go into My Options, you will now see the option of humidity level. To increase or decrease the level of humidity, use the dial to come to a humidity level option, press the dial, and you can increase or decrease the amount of humidity by turning the dial up or down. Most machines will be set to 4. If you find that you are having a lot of condensation fallout in the tubing, the humidity level is set to high and this should be reduced. Once you hit the level of humidity you are happy with, press the dial and that will be set. Again, return to the home screen by pressing the home button. If the screen goes blank, it doesn't mean that the machine has stopped working. All this does is mean that there is no light interfering with your sleep at night. The machine will still be running, and if you want to see what pressures are, press the dial and the screen is re-illuminated. To turn the machine on, the button at the top can be pressed to start the machine blowing air. This dial will tell you how much pressure is being blown. 4 centimetres of water is the starting pressure. The maximum the machine can go up to is 20 centimetres of water in pressure. Your machine will automatically titrate the amount of pressure you require by measuring the resistance in your airway, breath by breath, throughout the night. Because of this feature, the machine will automatically detect when the mask is on and when the mask is off. Your CPAP machine will be delivered with a mask. This is a generic mask, and masks will vary slightly, but the principles all remain the same. Your mask should come in a sealed package and have headwear, mask frame, cushion and elbow. Masks come in 3 standard sizes: small, medium and large. The fit depends how much distance there is between the crease of the bottom lip and the bridge of your nose. All masks will come with documentation explaining how the mask fits and how to keep the mask clean. The headwear has Velcro adjustments at the 4 corners This will be where the forehead is. This will be where the chin is. At the top of this headwear, there is a further set of Velcro straps to secure the headwear to the top of the head to make it more secure. The cushion is the main area of note that needs particular attention to keep clean. This area should be wiped down with a clean cloth each morning. Simply wet the cloth, wipe the seal and leave to dry. Every couple of days, the seal should be removed from the frame and washed in warm, soapy water, left to air dry, and then returned to the frame of the mask, ready to be used again. The headwear has clips, so once the headwear has been set, there should be no need to regularly change the headwear settings unless the elasticity within the headwear starts to give, in which case you might need to tighten the headwear. The headwear can come completely off and be washed in warm soapy water or popped into a pillowcase and washed with the bedding. Masks that are used in the home have exhalation ports at various points on the mask. This is either one hole, but more commonly a series of holes to allow exhaled CO2 to vent from the mask into the room. If your mask does not have a vent, please do not use it and contact the respiratory team and we will send the correct mask out. At the bottom of the elbow is a connector that will fit into the tube. This then allows the tubing to be taken away from the mask at any point to stop treatment. This is most beneficial when needing the toilet in the middle of the night. Simply disconnect the tubing, go about your business, the machine will stop, but when you return, the mask will be already in situ and you can reconnect and start therapy again.